the vaccine. So indeed, hope has arrived, I would like to believe, Abdul. And I'm excited to see the collaboration and the dedication with which we are getting support to fight this battle.
Exactly, and again, we having to go back to the genesis of the virus and what the government of Ghana has been doing to ensure that its spread is kept, so to speak. We go back to the weekly press conferences. In fact, every week there are 2 press conferences since March of last year to address issues relative to COVID-19. You believe that in some way has helped to keep the numbers where they are now, even though we are complaining that well, we've recorded too many deaths.
Yeah, and the other thing that I believe those press conferences have achieved is also to help us with misinformation and conspiracy theories that have surrounded the whole pandemic since the World Health Organization declared it a global pandemic in February of last year. So it has helped us to know what is right and what information is not right and which ones we should disregard. I remember when the coronavirus scare started and people started drinking all sorts of medical concoctions. The Ghana Health Service, through those press conferences, for example, had the opportunity to engage with people who were well-knowledged, well-learned in those fields to tell people what to expect, what to do and what not to do. Because we've learned from the experience in China that they have used certain systems that have worked for them. And so people were suggesting that we could try those as well. But the Ghana Health Service has guided the public reactions and the public access to information as much as they can. But social media has not made that easy, Abdul. And we still constantly find false information and fake news carrying such false messages across
we
to
see
people.
that the security personnel, all is about set now, indicating that we need to relocate in order to do their work safely, so that the vaccines arrive safely. We also need to stay safe anyway, so we will relocate whilst giving you all the information from behind the cameras, telling you all about what to expect as the vaccines are received. Just a little bit of background information that the flight carrying about 600 doses of the AstraZeneca, 600,000 doses of the AstraZeneca Oxford vaccine produced by Serum Institute of India has landed in Ghana's capital here in Accra. This delivery, of course, we know comes almost a year after the WHO first described the novel coronavirus as a global pandemic, and 8 months after the launch of the COVAX initiative, which was aimed at pooling funds from wealthier countries and non-profits to develop a COVID-19 vaccine and distribute it equitably around the world, Ghana has seen the arrival of the vaccines. The airliner carrying the vaccines landed about 10 minutes ago, is it? Yep. Yes, and we are now awaiting the
doses
to be transported from the aircraft to where the VIPs have gathered to receive them. We do understand that subsequently the president will be the first gentleman, of course, that is to be expected, the first gentleman to receive the vaccine.
I think the information is to start from the 37 military hospital, barring any hitches. And then they're expected to be transported possibly to other health centers to give greater access to our priority at the moment. And the first point of our vaccination plan is to get our frontliners safe and protected. So the plan is to give them the first dip. And so we're expecting the healthcare workers and frontline security personnel and persons with known underlying medical conditions, and then persons who are 60 plus and older will get the first initial opportunity to be given the vaccines. And we expect that a more detailed plan of what that entails will be unraveled later when the officials are able to make the speeches and make that information available to us.
Of course, yes. The rollout plan in Ghana is a milestone for the initiative that is trying to narrow a politically sensitive gap between the millions of people being vaccinated in wealthier countries and the comparatively few who have received shots in less developed parts of the world, including Ghana. We know that the AU has been trying to help the 55 member states here in Africa buy more doses in a push to immunize at least 60% of the continents. And Africa is actually made up of 1.3 billion people. That's a little lower than the Chinese population alone, and lower than the Indian population alone as well. But do we know of the vaccine and how it works in China as well? You know, all of this conversation started when coronavirus was first identified in the Wuhan city of China.
So China was initially getting, bad press a lot for the outbreak in the first place, and they faced allegations and accusations of not alerting the international community early enough to be able to put systems in place to curb further spread of the virus. But Abdul, if you would also recall, China, or news on China, has been largely very, very unforthcoming. So not much has come out from China in the past maybe 6 to 8 months, until recently when the WHO sent a team to investigate the start of the pandemic. And it tells you that largely, as we followed from the international press, that China has succeeded in managing its cases and is still, even currently, implementing strict measures, including quarantine, to keep those numbers down. So something certainly is working for the Chinese,
of course,
that the world is learning from.
Still talking about China and the vaccines in Africa. China has actually sent vaccines to Zimbabwe and to Equatorial Guinea as well, and they have started rolling out a program to ensure that everybody is vaccinated. And so China hasn't gone to sleep at all.
And they've always displayed their willingness to partner with other countries and other delegations from around the world to find us a collective end to this collective problem that we all face. Remember that even Ghana has benefited from donations from, for example, the Jack Ma Foundation.
Yes.
They brought us PPE, they brought us other supportive, intellect or intelligence to bear on our fight against COVID-19. So we cannot remove China from the equation, and they continue to throw in their support in the fight.
Yes. So, Thelma, you have, as we say in the media, intercepted, stumbled upon some information regarding the vaccination rollout plan, which we believe has been approved by the FDA. Yes. Again, this is just something we have stumbled upon, but we just feel that our audiences need to know about it as well. So you may want to...
So when we initially got the information, there was no confirmation from anywhere. But on Friday, when the Ministry of Health and its partners, i.e. the Ministry of Information, and then UNICEF, COVAX, and the rest, met at that very important press conference to talk about the rollout plan for the vaccination. They did let us know that the coverage would be for 260 metropolitan, municipal, and district assemblies, and that there will be 12,500 vaccinators involved with 2,000 supervisors, and they're expecting nearly 40,000 people to volunteer in this rollout program. So we are getting 2 FDA-approved vaccines. The FDA has come out to say they are safe and they will do the job, because there have been concerns that one of the vaccines may not be as effective against the new variant of the coronavirus. But the FDA has been quick to allay those fears and to say that, look, some protection, which is in this case is over 70%, is better than 0% protection at all. So people should have hope in the system that the vaccine will do what it's supposed to do, as we've seen in countries like the UK, where studies have come up recently, just in the past week or so, to show that vaccination has been one of the key things that have helped them to manage their cases.
Okay, so right now, I'm sure you're seeing on your screens the vaccines as they are being transported from the Emirates aircraft to the VVIP lounge here at the Kotoka International Airport, specifically Terminal 2. And we have a statement from the Ministry of Information regarding the arrival of these vaccines. Thelma might want to read that for us, even as we observe the arrival of the vaccines. 600,000 of them, we have been told. Thelma, what does the ministry say concerning this?
So here's a statement signed by the President representative at the Ministry of Information, the Honorable Kojopo Nkrumah. And it's a statement on the arrival of the COVID-19 vaccine in Ghana. And I'm going to read this as I received it. It says, the government of Ghana is taking delivery of 600,000 doses of AstraZeneca COVID-19 vaccine made by the Serum Institute of India, Covishield, today, February 24, 2021. This is the first consignment of vaccines acquired through the COVID-19 Vaccine Global Access Facility, COVAX, which Ghana, among 92 countries, has signed on to. COVID-19 vaccination will be conducted in phases among segmented populations. The first segment of the population that will receive from the 600,000 doses will be health workers, adults 60 years and over, people with underlying health conditions, frontline executive,
the Minister Designate for Health and his entourage, as well as the international in Ghana, and representatives from UNICEF and the WHO have all witnessed the arrival of the vaccines, have received them formally, and these vaccines will now be transported to other holding facilities in wait for the president to officially receive them and also be the first to be vaccinated in the country before the rollout plan is actually activated. So the vaccines, 600,000 of them, 600,000 have arrived.
Right. And we can see that as the trucks are being loaded, some of the delegation have started to leave. It tells you that we've come to the end of the official welcoming of the vaccines into Ghana. We are live in the capital, Accra, and we are at Terminal 2 of the Kotoka International Airport, what used to be our international travel terminal until we got a new facility at Terminal 3, and then the international travel was moved to that building. So we've seen Health Minister Designate receive the vaccines with his team from the Ghana Health Service and also the world partners from UNICEF, WHO, COVAX, and all those who have come to support us. Indeed, they have the eternal gratitude of a nation, because finally we may see some light at the end of what had appeared to be a rather dark tunnel. And for those who have lost their lives in this fight, we can never forget what you've had to sacrifice for us to gain knowledge of how to live with this new disease as we go on in the weeks and months ahead. And we cannot also say thank you enough to the COVAX team who have spearheaded this acquisition of the vaccines, because it is very competitive and a lot of countries are fighting to get vaccines. And for Ghana to be the first in Africa to benefit from the facility is really welcome news for its citizens. And we hope that the whole of Africa, indeed everyone everywhere in the world who desperately needs a vaccine in order to be safe and to survive, will get one sooner rather than later. And I'm
and
also
again,
hoping...
Thelma, just to cut in there, as you talk about Ghana being the first in Africa, we always need to emphasize the fact that we are referring to the COVAX.
To the COVAX
the COVAX, and not because other countries have received some other forms of vaccinations, but Ghana is the first to receive the COVAX vaccination facilities. That clarification, we need to keep making it before.
Yes, because vaccinations have started in other African countries.
Zimbabwe, Equatorial Guinea,
even
and
in South Africa. On the 17th of February, they started some vaccinations. So mind you, South Africa had to get new vaccines so that they can deal with their new strain. So the vaccines are being loaded,
yes,
and we can see that on our screen. Very historic scenes we are seeing here, Abdul. The end in sight in our COVID fight.
Of course, but again, we keep cautioning Ghanaians that this does not mean that we lower our guards. We are not out of the woods, not yet. And even for those who will be privileged to be among the first to receive the vaccines, it does not guarantee you against contracting the virus 100%. You still need to stay away from all the issues that can lead to a contraction of the virus. And that's what is important, that as much as possible, let's stick to all the COVID-19 protection protocols, even as the vaccines have arrived, and even as the rollout will start after the 2nd of March, when the president initially officially receives them and proceeds to give us the rollout plan.
Yes, I'm excited for particularly, obviously I'm excited for the whole country, but the people who are top of my list is for the frontline workers and all the people in the health sector generally who have been at the forefront of this fight, bravely fighting to protect the rest of us who I now refer to as mere mortals, because those people are heroes. They have saved the country a great deal of human resource, and they deserve every commendation that comes their way. I'm happy that with this vaccination, once they get it, they will have an extra layer of protection, because we know that the distribution of PPEs, from what we've been told, have not been at 100%, and we look forward to seeing the numbers become better, so that as we move on to other things to do in the country later on in the year, we'll be more confident of safety.
That's right, and even as you will talk about, you have spoken about frontline workers. You recall that when the president initially gave out some incentives to frontline workers, all manner of people came out to define themselves as frontline workers. I just hope that that controversy we experience will not happen this time around, and that the proper definition for frontline workers would have already been put out there for people who know that they belong to that circle or not, not to come out to create any unnecessary controversies, even as we receive this very exciting news.
Yes, I think that apart from the key people for me being frontline workers that I'm excited for the persons in the upper age demographic who have been identified as being vulnerable, so the 60-plus population. I'm excited that my grandmother at home will have access to a vaccine. Your father, your mother, who is advanced in age, will have access to a vaccine. I'm hoping that people would see the benefit of being vaccinated and so turn up en masse to take the jab, because we've seen other countries where people who have refused the vaccine have been offered alternatives which have been costly. What do I mean, Abdul? A friend of mine who lectures at the university in United Arab Emirates has been told that they needed to get vaccinated or pay for tests every 2 weeks from their pockets.
Wow.
So if you refuse to get the vaccination, you had to pay for the test yourself. And I'm hoping that it will not come to that point, and that everything that we are seeing today will be reassuring to the public, Abdul, so that they will be better informed to go out and be vaccinated. I'm excited at the level of partnership that we've seen here today from our development partners, and I'm hoping that the Ghanaian people would rally together, as we always have, to make this vaccination dream a reality and a success.
All right, and so Thelma, I think that's about it for now. For those who just joined, those are the vaccines getting onto the trucks to be transported to some other storage facilities for the rollout proper to be activated. 600,000 of them arrived in the country about some 30 minutes ago on an Emirates airliner.